is Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu. Australia's acting Chief Medical Officer Sonia Bennett has declared the unfolding situation in Australia concerning the Japanese encephalitis virus a communicable disease incident of national significance. The declaration was made under the Emergency Response Plan for Communicable Disease Incidents of National Significance in consultation with the Australian Health Protection Principal Committee. The Executive Director of Project Pink Blue, Runsi Chidebe, has called on the federal government of Nigeria to ensure that governors begin to implement cancer control plan in their various states. Chidebe, while speaking at the movie premiere on the challenges of cancer patients held in Abuja to commemorate the just concluded 2022 International World Cancer Day, expressed concern that cancer control is only left to the federal government alone. And the Edo State government has expressed concern about the recent increase in the number of confirmed cases of Lassa fever in the state, which has claimed the lives of several persons. The Commissioner for Health, Obehi Okaria, told journalists after the State Executive Council meeting on Wednesday that 136 people had been infected with a fatality rate of 13%. The new outbreak, according to her, is widespread through the Esaka Western, East and West local government regions of the state. International Association of Lions Club District Nigeria has lamented how children suffering cancers were being abandoned and allowed to get sick or die in the country, saying it is wrong for attention to be concentrated only on adults. The Lions Club District Governor Chief Kayode Osunuga, who served this in Ado-Ekiti, regrettably reviewed the scores of Nigerian children have been killed by cancer, with cancer of white and red blood cells called leukemia being the commonest. A professor of pediatrics at Olabisi Onabanjo University Teaching Hospital, Shagamu, Ogun State, Musili Fatuga, has expressed concern over childhood tuberculosis in some parts of the state, which has led to the death of many affected children. Fatuga, who spoke with journalists after delivering the 102nd inaugural lecture of the Olabisi Onabanjo University, disclosed that 52 cases were recorded at the OOUTH Shagamu during a period between 2004 and 2009, adding that the cases involved children of school age and who also belong to the low socioeconomic rung of the society. This is TOS Television Network and you're watching Health 54. More stories when we return. Welcome back. The Nigerian Medical Association, NMA, Oyo State Chapter, has announced the loss of 2 of its members to Lassa fever within 72 hours. The announcement was contained in a statement by its chairman Ayotunde Fasunla on Thursday in Ibadan. The Nigeria Center for Disease Control and CDC has announced the outbreak of measles in 8 states of the Federation. The NCDC, in the latest measles report, announced the affected states of Jigawa, Anambra, Katsina, Rivers, Enugu, Delta, Osun, and Sokoto states, while 908 suspected cases had been reported so far. The center also stated that there was an ongoing outbreak of measles in Zamfara, which had not been confirmed due to a lack of testing reagents in the country, adding that 58.7% of confirmed cases had not been vaccinated. The World Health Organization on Thursday approved the new antiviral medicine Molnupiravir for the treatment of the Omicron variant of coronavirus. This is the first oral antiviral drug to be included in the treatment guidelines for COVID-19. Aside from its new approval, the Global Health Body also recommended that casirivimab and the VMAB should not be used for patients infected with the Omicron variant. And Colombia's constitutional court has decriminalized abortions within the first 24 weeks of pregnancy. Under the new rules, no one will be prosecuted for having an abortion within that time frame. Since 2006, abortions have been allowed in Colombia in cases of rape, when the woman's life is at risk or if the pregnancy is not viable. And just before we go, a report has revealed that most military veterans suffer cardiovascular diseases and hypertension. An analysis of disease profile by the Defense Health Management reviewed. The analysis, which was done between 2015 and 2020, was carried out in 2 modules of International Classification of Diseases, also known as ICD-10, and the module that presented the nominal diseases as individual pathologies. And that is Health 54 right here on your digital first Pan-African news network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS TV Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS TV Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching.